Asthma and sinusitis awareness. Today, asthma and sinusitis are increasing in frequency and morbidity. When a person has asthma, the patient's and his family's cooperation are very important. Parents must keep an eye on the complex treatment that includes pills, inhalers and exercises. If there is poor medical service, asthma and sinusitis are likely to get worse. Asthmatic children have higher risk of getting sinusitis from exposure to second-hand smoke. On the other hand, people with chronic sinusitis are sometimes at higher risk of developing asthma. When asthma comes with sinus infection, simple treatment will not do. Since the nose is blocked, the individual is forced to breathe through their mouth, which can likely hasten an asthma attack. Likewise, air breathed through the mouth is colder than the air breathed through the nose. And cold air is known to trigger asthma attacks. Overuse of antibiotics, environmental factors, bacteria and fungi among others often increases the occurrence of asthma and sinusitis despite the advances made in treating these conditions. If both asthma and sinusitis are considered as inflammatory diseases, then their treatment is likely similar. Patients should drink enough fluids and bacterial infection should be reduced by means of breathing and coughing exercise, various enzymes, exercise, iodides, guaifenesin and irrigation. However, if the sinus infection does not improve with antibiotics, a CT scan may be necessary. Asthma and sinusitis are often treated at the same time as what affects the sinus affects the entire upper respiratory system. You are likely to identify asthma if you are aware of its causes and symptoms. Symptoms can generally range from mild shortness of breath to chest pain, coughing and tightness in the chest. Common asthma triggers include indoor and outdoor allergens, infections, tobacco smoke, wood smoke, air pollution, certain medication, weather and even strong emotions. Some episodes of asthma attacks can be very severe and even life-threatening. For this reason, education of patients is very important. Also, prompt diagnosis and treatment of sinusitis is important in the long-term management of asthma. And in order to effectively control the symptoms, it is important to know what triggered the attack and then avoid those causes. Understand that sinusitis can worsen asthma. However, many patients who have successful treatment of their sinus infection find that their asthma also improves. Controlling the inflammatory process in the nose can help to control asthma symptoms. And along with prevention and treatment, maintaining a healthy, well-balanced lifestyle and diet is also very important. After all, a healthy body is likely to get sick.